Can you do roll call, please?
Yes, sir. Chairman O'Halloran,
Here.
Mr. Jones,
I'm present.
Miss Odell, Miss Stone,
I've been present since 10 o'clock, but y'all did not hear me.
okay, Mr. Cody, Mr. Leggett, Dr. Robinson,
Here.
Mr. Lakakis is excused. You want to make the announcement?
He's not excused. We have to vote to excuse him.
Would you like to make the announcement, Chairman?
Have we finished roll call? I didn't
Mr.
hear all the
Anniston.
responses. Okay.
Mr.
I need a
Anniston.
motion to excuse Pete Lakakis. His wife is sick and in the hospital.
I second the motion.
Someone has to make the motion. I can't.
Oh, I motion we excuse Pete for personal reasons.
Okay, second. All those in favor?
Aye.
Me, aye, whatever.
Opposed? Okay, Pete's excused for this meeting. Did we appoint anybody for the inspirational opening today?
I don't believe so.
remember.
We did.
You did?
I'm sorry?
Yes, Patricia Harris Moorhead will give the inspirational opening.
Oh, good. Thank you, Patricia.
Okay, Miss Patricia.
Thank you, Beverly, for hearing me. Well, good morning.
Morning.
Good morning.
Morning.
On this last day of March, I would like to acknowledge that March is Women's History Month. Women's Month is an opportunity to celebrate and reflect on women's achievements, as well as the struggles
I hate to interrupt. Patricia, but I cannot make out what you're saying.
Okay,
I
let
hope
me
it's only me.
get a little closer to the mic. Is this any better?
That's a whole lot.
Yeah, that's better.
Okay,
A lot better.
all righty. I'll start over. On this last day of March, I would like to acknowledge that March is Women's History Month. Women's Month is an opportunity to celebrate and reflect on women's achievements, as well as the struggles that have faced the important role they continue to play in society. I am proud and appreciative of many talented women who serve on our board of directors within our council organization. Many of you are aware Chatham Area Transit is a public service entity providing mobility solutions to our community. Yes, we seek to serve and meet the transportation needs of our customers. As such, I would like to remind you of the service and sacrifices of 4 women who have been honored through the Savannah Bell's ferry system. Julia Gordon Love was the Girl Scout founder who pursued education and interest in Europe before returning to her home Savannah, proclaiming, "I've got something for the girls of Savannah, to all of America. We're going to start tonight." Her legacy continues to give girls opportunity to develop self-reliance and resourcefulness. Susie King Taylor was a civilian who rose from slavery and secretly learned to read and write at an Weston school run by a free person, Elaine, in Price and Hatcham streets. He was the first Black Army nurse and was an all-Black Army troop, later redesignated 33rd U.S. Colored Regiment, where she became a teacher, nurse, cook, and a seamstress to the soldiers. He later opened a school for Blacks in Savannah, later in Liberty County, seeking to serve other African Americans who had a desire to read and improve their lot in life. Florence Martis, known as the Waving Girl, greeted ships that entered Savannah Harbor from 1887 to 1931, establishing a worldwide reputation of hospitality for Savannah. She welcomed passing ships by waving a white scarf by day and a lantern by night for 44 years, giving hope to them along their journeys. Lastly, Mary Musgrove was an English-speaking Native American who played a key role in the early days of the colony. He served as an interpreter, General Oglethorpe, was a negotiator with Comanche and the Creek Indians. Her role demanded that she be a strong and effective communicator while delicately balancing the needs of both sides. All of these women demonstrated a selfless spirit of serving. I proudly recall their endeavors and sacrifices made for others, and sometimes done so under difficult circumstances. Let's emulate that spirit as we strive all that we can to serve our community in continuing our efforts to provide great public transit options to the people who live here. Thank you.
Thank you, Patricia. Okay, let's move to approval of the board minutes. First is the regular board meeting from February 25th. Do I have a motion to approve?
Motion to approve.
Second?
What are we voting on?
The minutes of the regular board meeting? Did I get a second on that?
Not yet, no, sir.
Can I get a second to approve the board meeting minutes from February 25th? Beverly,
Yes, sir, I'm here.
did we get a second?
We have not. We need one. No, sir.
Can I get a second to approve the board minutes of the regular meeting from February 25th? Hello, folks. We need a second. Can you unmute everybody, Beverly?
Everyone is unmuted. I'm not sure why some are going back on mute.
Can you hear me?
For the record, I am not going to second it. Number two, and you do not need a second. If we do not have a second, you can postpone it until we have another meeting to vote on those minutes.
Well, that's what I'm waiting for. If no one's going to second it, then that's what we have to do.
All right.
I got a motion, but no,
We still have a quorum. Yes, sir.
so we have no second, so we'll move the minutes to the next meeting for approval. So can I get a motion on the meeting for the special meeting on March 24th?
I also move to approve those minutes.
Do I have a second? Hearing no second, we'll move that to the next meeting. Action items, Mike.
Thank you, Mr. Chairman. The first issue is to request board approval of the award of the consulting service contract for the development of an incentive compensation model. CAT has identified the workforce engagement as a critical component necessary to maximize staff potential. CAT's strategic plan includes the development of a performance evaluation and compensation model that provides for and implements an incentive-based component of employee compensation using a metric-based scorecard to evaluate merit. The facts and findings are in your board packet. And the results of the evaluating committee results are also in your packet. And so staff recommends board approve the award of the contract to Transpro for comprehensive compensation consulting services in the amount of $96,619.
You remember we tabled this last month because we thought we would prefer to bring it in-house. So if we want to do that,
Yes, sir.
He said, Mr. Brown said 96,619, but the agenda memo says 95,619.
Oh, okay.
Mr. Brown, did you hear that?
I did. Let me go back and look and see where I got that. Procurement process. I apologize. Yes, I misspoke. It is $95,619. My apologies.
Thank you.
Thank you.
Okay, and if we remember last month, we decided to table this because we thought we would prefer to go in-house. The motion was tabled. If we want to keep it in-house, then we have to vote no on this particular award. Would anybody like to make a motion to not award the contract to Transpro?
If nobody first and
I
seconds
so
it, can,
moved.
Was that Dr. Robinson?
Yes, I
Okay.
move that we not.
all we have to do is not vote on it.
It's a motion to deny is what it is. A motion to not to disapprove.
Can it be retabled, Ty?
Yes.
Is that what everybody wants?
Well, I
If we
just
don't
made a
get-
motion to not approve it.
Do we have a second to Dr. Robinson's motion?
I'll second it.
Okay, all those, any discussion? Sorry.
I'd like to know just a little bit more about what our backup plan is for implementing this in-house. I know there was some discussion of coordinating with the county on helping us with these services. Do we have any updates on that?
Not in this particular motion. This is a specific recommendation not to use Transpro. Because
Correct.
the board seemed to feel that it would be more prudent to do it in-house.
Correct.
And we're
Do
going to
we
have
have-
to get a report from that committee once we assign it to them, because if we didn't assign it to them, they haven't really gotten a chance to come up with a plan.
Which committee would that be?
Human resources.
Our human
which-
resources or the county's human resources?
It's ours because we're the one implementing the plan with an assist from
Mhm.
people at the county. If it's needed.
This is definitely an area that I am not as familiar with, nor really comfortable making a decision on this. So I'll defer to expertise of others on the board and at staff. If we have qualms about moving forward with Transpro, then okay, I'm totally that's definitely not work with them. But I do think that the end goal of this resolution, which is to create an incentive compensation model, I'm very interested in getting that done sooner than later. So if I can just get a little clarity about how we're going to be moving forwards with this.
Yeah, once
That'd be
we
great.
deny the
You-
Transpro contract, then Mike can instruct HR to move forward on coming up with an in-house plan.
Great.
And Chairman, I think Ms. Stone has discussion. Ms. Dion, do you have Ms. Stone? Ms. Stone?
Yes, I had a question and I wanted to know if has he talked to the county about participating in this?
I had a
No.
conversation. Oh, I'm sorry. Do you want me to answer that?
Yeah, if you're the
Yeah, I
one
had
who
a-
did it, yes. That's an
Yeah, I
in-house.
reached out to Carolyn Small, she's HR for the county, and she was enthusiastic about helping us with anything we needed. So it was just a casual conversation. We haven't had more in-depth discussion about it, but we can certainly, if the board wants us to go in that direction after this vote, we will certainly reach out and continue the discussions in a more detailed manner.
Does that answer your question, Helen?
cancel something that in all honesty, needs to be done.
Yes, it does need to be done. This has been on the books for over a year and a half without any action.
But that's what I'm saying. I mean, I was hoping would have had some discussion with the county by now to understand whether the county is willing to participate in this or whether we are or need to find another company. I mean, I'm a little bit at a loss as to why we don't have option A or option B here.
We've already sent out the RFP. We got 2 responses. This is the one that they picked. We decided we don't want to send it out of house.
But
The county
But
does
at the
not have
last
to,
board
the county
meeting,
does not have to
that
be
was-
involved in this.
we wanted to-
We are
county is-
our people in-house. If they need help from the county, they can ask. But we're tasking our own HR department to come up with the program.
Okay, but then it changed next week. I mean, that was for,
What was that? I missed part of that.
and she gave,
Does that get the question answered? I'm not hearing anything. Hello?
I'm here.
Well, I'm trying to find out if that answered the question.
Who was that just talking?
I don't know. I'm hearing voices coming in and out.
so why do they even have,
I believe that's Dr. Robinson, but she's cutting out.
No, that's not
Yeah.
Dr. Robinson at all.
That wasn't
Oh.
Dr. Robinson.
Who is that?
It
Is that
sounds,
Helen?
it sounds like staff.
Got it.
Everybody needs to announce themselves.
Mm-hmm.
All right, staff needs to mute out so we can get through this agenda.
That's what's
I
happening.
think it was a mistake. I think somebody's unmuted by mistake.
That's okay. Do I have any more discussion on the contract from TransPro?
No, not for me.
Anybody else? Hearing no other discussion, I'm going to bring the motion forward that we decline the contract to TransPro to do the incentive compensation plan. All those in favor say aye.
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 You're not
Aye.
gonna do the,
I think you need to do it by roll call.
thank
Okay.
you.
All right, let's do it by roll call.
Yes, sir. Chairman O'Halloran,
Yes.
Mr. Jones,
Yes.
Ms. Odell is not on the call. Ms. Stone, Ms. Stone,
to let go of this thing, but
Is that a yes or a no? I couldn't tell.
I guess yes, but I wanted options and we don't have options at
This
this.
discussion is not supposed to be done at this time.
Dr. Robinson,
Sorry, I can't hear.
Dr. Robinson,
Yes.
okay, Mr. Emerson,
Yes. I say yes.
okay,
Okay, that was,
that's 5, Chairman.
okay, so we're gonna let TransPro know we're not going forward with that. Okay, Mike, let's move on to the legislative advocacy RFP. I don't like
Thank you, Mr. Chairman. To request, the issue is to request board approval to issue the request for proposal, the RFP, for the legislative advocacy services. Chatham Area Transit Authority seeks highly qualified legislative advocacy representatives to plan, develop, coordinate, and implement advocacy services on behalf of CAT at the local, state, and federal levels. CAT will seek proposals from qualified vendors to provide advocacy services at the local, state, and federal levels. Vendors will be required to identify what level or levels of advocacy services they can provide to CAT in their proposals. The procurement will be conducted in accordance with CAT procurement guidelines, and proposals submitted will be evaluated using the criteria that is in your board packet. Let's see. Staff recommends the board approve the issuance of the RFP for legislative advocacy services.
Do I have a motion to approve the RFP?
Okay, I'll do roll call.
Move to approve.
Oh, okay. That was
I move
Mr.
to approve.
Anderson.
This is Clinton.
Thank you.
Second? Do I have a second?
Yes, Ms. Stone, second.
Okay. Any discussion?
This
Thank
is
you.
Dr. Robinson. Can
Yes,
you hear
Dr.
me?
Robinson, go ahead.
What I'd like to know is how much or how often will the board be communicated to the process? And my other question, voted on it, how soon will this actually start? How soon the process start?
I only heard part of that. I'm sorry.
Okay, I had two questions. Number one was, once we vote on this and the process starts, how often will the board be communicated to by staff? Secondly, once we vote on it, how soon will they actually put the RFP out?
The RFP is ready to go. These contracts expire in November, so that's why we're starting now to get the RFP together so we can have it approved by November. Generally, we get a monthly update from both Patton Squire Briggs and from the Backer firm.
Then that wasn't my question. My question was about the RFP itself. Once you let it and you start getting responses to it, how often will the board be updated on how the process is going?
They'll bring it to us. There's a cutoff date on it. When that's done and it's evaluated, the staff will bring it to us to review. Does that answer your question?
So I'm assuming that during the process, we don't get any updates. We only get it after.
Let me say something, if I may, Ty Butler.
Thank you, Mr. Butler. Go ahead.
Under FTA procurement regulations and best practices, the board is not supposed to be involved during the evaluation process. The evaluation committee and staff bring their evaluation and their recommendation to the board to vote on, but the board is not supposed to be involved in it during the evaluation process.
Thank you, Ty.
Also, if I might add this, as we've experienced before with RFPs, if the procurement committee for this RFP brings forward a list of 2 or 3 candidates for this contract.
No. They bring forward the selected one.
Exactly. That's what I'm saying.
Made on the last one with the concrete vendors. They will bring forth the recommended group to do this. It's not a discussion for the board as to what the process was to pick the vendor that they selected. We either approve or don't approve that vendor.
Correct. That was the message I wanted to make, is we won't be able to have discussion on which ones. We'll just only be able to move forward. It's a binary choice. Either move forward with what the staff has recommended or not.
Yes.
So I
which
think,
is
you
the
know,
way all the RFPs that are supposed to be done.
Gotcha.
Yeah.
Thanks.
Any
I
other
just don't want to,
discussion?
catch us
Oh.
off guard.
Do we have any other discussion? Hearing none, let's move to vote on releasing the RFP for the advocacy. All those in, Beverly, let's do it by roll call.
Yes, sir. Chairman O'Halloran,
Yes.
Mr. Jones?
I'm against it.
Okay. Ms. Stone,
Yes.
Dr. Robinson,
Yes.
Mr. Emister?
Yes, I'm for this.
Okay,
Okay,
motion passes. All right, next moving on to Mike, the procurement policy and procedure revisions that we tabled from last month.
Yes, thank you, Mr. Chairman. The issue here is for the board to approve the revisions of the procurement policy manual. CAP's current procurement policy and procedures manual needs to be updated in order to incorporate additional information due to FDA recommendations and regulation updates. The procurement policy and procedures manual was reviewed by staff and updated for recommendations by FDA reviewers and updates in federal regulations. A summary of the changes is included in this report, and it includes the changes based on additional FDA feedback received in February 2020. And as a result, the 2019 procurement triennial findings closure process. So staff recommends board approve the procurement policies and procedure manual as presented.
Okay, do I have a motion to accept the procedure revisions?
I move to approve. This is Clinton.
Second,
Stone?
second from Helen.
Yes.
Okay, any discussion, pardon?
This is Gertrude again. This was sent to committee, and my committee has been newly formed, and we have not had the opportunity to discuss the procurement policy as a committee. So I would like to have more time to do that by committee.
How much more time?
Well, given our current situation, we can meet, my committee and I can meet via teleconferences. We've already got a copy of the red line, and we're starting to review that. We just have not met as a committee. We just added a new member to our committee, and we're trying to update him and get him on board. So the chairman can decide how much time he wants to give us.
For how long you think it would take?
Mr. Chairman, you want to give us some guidance there on how long you willing to allow us?
Well, Dr. Stone just asked how long you think you're going to need, because this is something that is been going back and forth for a while now.
Right, and as you know, as a committee, I've not had a full committee up until now.
Yes. But this was started before we went into committees, because this was done by the staff that does procurement.
So that was
I've been
before.
working on it for like 6 months.
Yeah, well, that's before me, so I'll have, because it came to committee, and we were trying to work on it, and then my committee dissolved. So I'll have to take a leave for somebody who's been doing this longer than myself.
These were changes that were either required or strongly recommended by the FDA after their audit.
Right, you're right, they were strongly recommended, and we, as a committee, we were taking a look at those to make sure that it was what was needed for CAT as a committee. But again, if this started before me, then I'd have to kind of hand it over to somebody who's been doing this longer than myself.
Well, that's why we had Terry and her staff do this, because they're the ones that do it on a daily basis, and they did the recommendations with back and forth with the FTA to come up with the document that they presented today. Terry,
but-
do you want to just give us a background on this quickly?
Before you do that, Chairman, but my point is that it came to committee. And as a committee, we were asked to take a look at it. And as I said before, my committee dissolved. And now we have a new committee. And what I'm asking is if it's going to stay in committee, then we need to have the opportunity to review it and provide input.
It was actually never given to the committee. It was given to staff to update and review it with the FTA after the triennial review. This is basically just the board adoption of the policy that was recommended from the FTA, which is whose lead we have to follow on all these procedures.
They were well,
I mean, the committee can review it because it has to be renewed annually. So we can start that process once your committee's up and fully functioning. But for the time being, we had staff do it with the recommendations from the FTA, which
Okay,
they
well-
do on a regular basis.
well, just know that I'm going to vote no, only because there's some misunderstanding what I've been communicated with.
That's fine.
Okay.
Any other discussion?
Mr. Chairman?
Well, I know that we had,
Hello, I've got two people talking to me.
yeah, that sounds like Terry. I'll recede.
All right, Terry, can you just shed the light on this for me, for us?
Sure. So every year there are changes in regulation. So every year we look at this policy and incorporate the regulation changes. Dr. Robinson, you can approve this document and then you can move to review and modify per the committee's request as long as it doesn't contradict FTA rules. So approving the document with the changes from legislative updates and reviewer suggestions does not prohibit you from doing additional work after you approve this document to make it more what the board wants, as long as it doesn't contradict current regs. So this is not the be-all, end-all. You can approve this document as presented, and then you can move it to committee for further review and modification per the discussions, the preliminary discussions we've had, where you wanted to tighten or change a threshold. All that can be done even if you approve this document today. We can revise it again and bring it back to the board for approval with your committee's input.
Okay, thank you, Terry.
I've got a statement or just blah, blah, blah. Let's see. So I think that's probably not a bad idea. I just know that this has been sort of bouncing around with our board for a while. I'd like to know a little bit more about the risks that we're inflicting on ourselves if we don't pass this timely. But I also do absolutely agree with Dr. Robinson that we haven't looked at this in committee. I would be in favor of doing like initially approving it and then looking at it with the policy committee. I do know that we've had conversations about specifically the microtransactions or small purchases. There was an email I sent out about a week ago after our last meetings to convene around that conversation that has yet to develop, and it's fine because it's been a crazy week. But let's do it. If we're gonna do it, let's do it. And I would be okay with amending the motion if that could pass it. If not, then I'll also vote to, I don't know.
And the changes in this document are not really choices. So staff is required to follow the regulations as updated. So this policy documents those updates. And so an adoption would help because then we would be operating within an adopted policy. but you can review and amend multiple times as you see fit. So this doesn't prohibit you from moving forward with a comprehensive review and additional revisions either 2, 3, 4, 5 months from now. So it would help us because then the policy in which we're operating, which meets the current regs, would be adopted by our board. That's the help.
Chairman, Commissioner Jones' hand is raised.
Go ahead, Jay.
I'm just trying to follow protocol. Appreciate that, Chair. I got 3 questions. I just heard what Terry said. Isn't this a document we've already submitted in draft form to FTA?
Yes. This goes back to, I don't remember, November, December.
All right. My second question is, they already have it in draft form. It's been about 4 months. They have not had anything to say about the draft form?
Yes, they have. I'm sorry.
Sorry, I don't have that information either.
I was asking Terry the question.
Yes, so they reviewed the whole policy in draft form in September when they were on site. And the changes at the bottom of the control log, they asked us to entitle, we added solicitation checklist. So those 2 sentences were changed. That was their recommendation. And they have reviewed that, concurred, and closed the triennial findings. So from the FTA's perspective, this document is good to go. Only step that's missing at this point is the formal board adoption.
All right, and let me get what I heard just a second ago. So basically, if this document is approved, it
By
can
the
still go
FTA,
into
yes.
committee. Huh?
Oh, I'm sorry. Go ahead. I'm sorry.
If this document is approved by this board, Dr. Robinson
Yes.
and her committee, Dr. Robinson and committee can take this document and review it, and any isolated changes that she thinks or the committee thinks that needs to be brought forward can be brought to the board and amended. Of course, it has to be in guidelines with FTA, and I know that. It can be amended and sent up to FTA for approval or for revision.
So you can, all of that is true, except for we would not have to send the revised document to the FTA. The FTA would look at the revised document under their next standard review and either concur or make recommendations at that time. So we are allowed to manage our policies and expected to manage our policies per the regulation. And during their normal course review is when they take a comprehensive look at it.
So they won't
everything
look
you
at it.
said is, they won't look at it again until they come in for one of the standard oversight reviews. So you can modify it as long as you don't contradict their regs, and you can contradict it. It just is a procurement finding and funding risk. So you can modify it off cycle with no submission, review, and concurrence requirements from the FTA. They'll look at it the next time they come in for a regular review. They will look at either this policy or the policy as it's amended with Dr. Robinson's committee's comprehensive review.
So any amendments would go into effect if we voted on it in-house.
Yes.
Okay, and then
immediately without FTA review and concurrence.
Yeah.
Dr. Robinson, hands up.
Yes, ma'am.
Can I finish my conversation?
No.
Go ahead. I yield the floor. I'll raise my hand after Dr. Robinson says what she has to say.
If you guys can recall in the previous meeting that the committee asked that the board asked that staff would send us in writing what the FTA response was when they were talking about we were probably getting in trouble and that kind of stuff. I never saw that email. So as a
the email is recent, Dr. Robinson. It came in after those discussions.
As a committee member, as a committee chair that was looking at this document, I never saw the response. That's why we were asking for more time, because we didn't get what we asked for months ago. So, I mean, that's my comment, but it does not change my vote. I am going to vote no.
So the email concurrence was pending during committee discussions and just came in last week. So the information was incorporated into this month's board report. It's recent. They just closed the findings. I don't have the data in front of me, but it was after the committee. It was pending at committee.
My hand is raised, and then I'm gonna motion for approval.
Okay, Mr.
Go ahead, Jay.
Can those findings be forwarded to Dr. Robinson, her committee?
Yes, sir. It's the request to add solicitation checklist to 2 sentences. Those were the recommendations from the triennial review.
All right.
We added
Once again,
two words to 2 sentences.
Once again, can that email be forwarded to Dr. Robinson, her committee?
Yes. Yes, sir.
Thank you. Then in that case, I move for approval.
Anybody else have discussion? I haven't closed it yet.
Are we modifying the amendment or the motion?
No.
I don't think modification is needed, but I mean,
Got it.
It's been so long, I don't remember what the motion was.
The attorney just said no.
I said no, so any other
Yeah,
discussion?
the motion is to approve the changes in the
Right,
policy.
correct.
all right. If I'm not hearing any more discussion, let's vote by roll call. Beverly,
Yes, sir. Chairman O'Halloran,
yes.
Mr. Jones,
Yes.
Ms. Stone,
Yes.
Dr. Robinson,
No.
Mr. Emister,
Yes.
Okay, motion passes. Mike, who's doing the presentation on the COVID safety? Erica?
Yeah, I'm gonna have Erica give an update on the latest of the COVID-19 and coronavirus pandemic.
All right,
Erica.
sounds good. Welcome, Erica.
Good morning. Thank you, sir. Can everyone hear me okay?
Yes.
I hear
Okay,
you well.
great. Okay. Okay, Beverly, do you want me to wait for you to get the presentation slides pulled up, or do you want me
Yes,
to
ma'am.
proceed?
Yes,
now?
ma'am. Give me
You're
1
working on it.
second.
Okay. Well, while she's doing that, I'll go ahead and say I've got a few slides for everyone to look at. It's a quick briefing that includes some of our efforts internally and externally to mitigate the spread of coronavirus and to educate our employees and passengers. Some are internal controls, some are just activities, some are education. And so I'll kind of go ahead and I'll give Beverly just a second. We obviously have been doing this since early March, so there's been a lot of activities, a lot of learning, a lot of research. So we've spent a great amount of time on supporting the efforts to help our passengers and employees and the city and county with their efforts as well. And I'll go ahead and say we, on a weekly basis, we have 3 times a week now conference calls with Chatham Emergency Management Agency, SEMA, our partners there, and all the municipalities are on those calls, and we're able to give them updates to our services and activities, and also receive updates from other municipalities and have an FAQ session, a roundtable, and see what other agencies are doing. So that has helped us a lot. Okay, Miss Beverly, I'm ready.
Okay, we're ready. Thank you.
So on our first slide, you'll see just a list of some exercises. And in very early March, we went ahead and started a tabletop exercise, which included upper leadership. And what we did in that tabletop is we went through scenarios and talked about phases and what we would need to do and how to react. And that was a good way for us to identify any gray areas.
Those of us on the phone cannot see the slides.
Hmm.
I'm sorry about
Did
that.
you hear that? Did you hear that? Okay, Erica.
No, I didn't hear anything.
Yeah, what Ty said is that those on the phone cannot see the slides, so you may have to talk through the slides a little bit more for those folks.
Okay. That's okay. I'll continue. We also implemented enhanced disinfection of facilities and equipment, and in a few more minutes, I'll kind of go through some controls that our maintenance department has implemented there. Effective early March, we also canceled any business travel following the suit of many other agencies and businesses. Any company events were canceled in order to adhere to the gatherings and physical distancing requirements. And obviously now we're requiring all meetings and to be virtual and limiting any face-to-face interaction as much as possible. March 25th and beyond, we reduced the fixed route service to a modified Sunday schedule. We have reduced the capacity on fixed route buses to 50%. Now, obviously, this is to adhere to physical distancing requirements because that is now under the orders a legal requirement. This is a challenge, and we're continuing to try to come up with ideas and looking at what other agencies are doing to at least be able to provide some service. We've asked our operators to be patient and our passengers to be patient, and trying to put out more communication about that so they understand why we're doing that and to help us comply with the requirements. Fare-free service obviously is continuing on all modes. I believe, as you know, I don't have the date written down, but last week we did discontinue the ferry service because of extremely low ridership. We implemented rear door boarding on the fixed route buses in order to minimize close distance interactions. However, of course, passengers that still need to use the ramp with a mobility disability can still board through the front door to use the ramp. We closed off public access, so that included our ticket window at the ITC and the CAT Central lobby. We did also increase, just after St. Patrick's Day, we increased our security at the transit center to 24 hours a day because even prior to this situation, we were having a lot of issues after hours with loitering. So I hope that's been helpful. We've seen a little bit better with security at the transit center, with keeping people from congregating in large groups. And I'm sure most of you've heard a little bit about on the press conferences yesterday with the county. Dennis was announcing that SEMA director that they're going to start implementing health checks on passengers coming into the county. So that'll be at the airport, and that will affect our transit center for Greyhound. They haven't told us when they were going to start that yet. They're still waiting on PPE to come in. Personal protective equipment, as we know, that's on back order for everyone. We have implemented a minimum basic operations and remote work plan in accordance with the orders. And we are coordinating this week and going forward some virtual town hall meetings for all staff so that they can call in and speak to a panel of leadership. We'll give presentations similar to this one and then open it up for questioning for all employees with concerns or just general information. Okay, and I don't know if you can see the next slide that's going to come up or not, so I'll try to explain it to you without the visual. It is a bus cleaning and sanitizing checklist that our maintenance department has created at the request of the board as well. And if you can't see the form, it's got the bus number and the date and some instructions. And the instructions are that the form is to be completed for every bus that's clean, and they have to indicate a yes or no for every action, and we'll see the other actions too in a second on a larger like spreadsheet they have to complete. And after they complete the checklist, it's supposed to go to the supervisor, the shift supervisor, for inspection. And at the bottom, they have to certify and sign that it's clean and sanitized to our standards and protocols before it's released back into revenue service. Okay, and on the next one is the spreadsheet itself. and it's probably going to be tough to read all the small font, but it's got a whole column there for areas to be clean and sanitized, and it goes over the protocols of wiping down all the high touch surfaces with the approved sanitizer cleaner, and inside and out where the bus is frequently touched. I won't read every single one of those, but you kind of get the point. For all the high touch areas, a lot of sanitation efforts are to be made, and action completed has to be signed off yes or no. So this form is implemented by our maintenance department, and I wanted to include that so y'all could look at it. On our next slide, there's some signage that was submitted to me by our by Miss Patricia and her staff. They had these created. Obviously, they're not to scale, so I hope you can read them, but I'll kind of go through. The one on the left that is vertical says, you know, keeping travel safe, what can we do? And all of these are the recommendations by the CDC. You can see the hand washing and the close contact, and mainly what we're trying to reiterate and have asked for help with SEMA and our other agencies is to help us get the message across sternly now that, you know, please don't use the service if you're not going to an essential, you know, service, essential function. If you're not going to work or medical or grocery shopping, please don't be out joyriding. So that's something that's kind of hard to manage, and we're asking for help getting that information out. The one on the large one on the left was one that was posted at the transit center, and then the ones on the right are tent cars that are going inside the buses, and it says basically the same verbiage. Next, we have implemented some internal controls to help prevent the spread of the virus with our employees and our staff, and obviously it protects the public as well. So these are some protocols we've implemented. It's what to do if. And this first one is for all employees, and I'll kind of go through some. It says, please do not come to work if you have symptoms of COVID-19, you're sick with COVID-19, or you've been exposed to or living with someone with COVID-19. And it gives step by step, you know, notify your supervisor right away. We're expressing to all employees, and obviously managers that have direct reports, that this will be confidential. Obviously, it's a very sensitive subject, and we will track it internally, but it's confidential. Reiterating to stay home except to get medical care, and how to come back to work if any of those three scenarios have taken place at the top. We're routing everybody through human resources so that they can track and record confidentially and help the employee get back to work. And at the bottom, it's just some verbiage that came from the Department of Public Health, how to remove yourself from isolation. And the next slide is just another internal control. It's a protocol for managers, what to do if, and this one is what to do if your employee reports those three scenarios: that they have symptoms, they're sick with COVID-19, or think they've been exposed to or live with someone. Tried to simplify these as best as possible. You know, please remain discreet and confidential. And we've given some steps. Obviously, if the employee's at work and they notify, we're going to have to isolate them right away and try to get them sent home and encourage them not to leave the house except to get medical care. Okay. Let the employee know that human resources is going to contact them. And then that supervisor is to notify HR right away. We put contact information on there for email or phone number directly to Ms. Tondra. And then Ms. Tondra is going to follow up with the employees, track the data, and will let the respective department know when that employee is clear to return to work. And we've reiterated to department heads, if that employee contacts them regarding return to work, just to redirect them through HR. This helps to make sure everything remains confidential and that we're all on the same page, and everyone is addressing these situations the same way and fairly. Okay, and my last slide, I just wanted to interject a little humor here. I know we could all use some humor at this time, and I'm sure everybody's learned to do things with teleworking or go to webinars or Zoom or Skype. So those are my final memes there that I found that are pretty funny. I think we can all agree that this has been a learning process for online meetings and communicating. So that's all I have, and I open it up for questions at this time.
Thank you, Erica. That was very well done.
Erica,
I-
this
Thank you.
is Dr. Robinson. Or are you familiar with the new mobile app that St. Joseph has implemented?
No, ma'am.
It's relatively new. I think it happened within the last couple of days. That
Okay.
you can actually, but it's an app.
It's free.
I'll make a note.
All right.
I think Memorial has one also. I know my doctor's office, which is Memorial Physicians, has an app
Oh,
for
is
you
it
to
for?
contact them with.
Okay, yes, ma'am. I see. I have heard about that. That's for people to check in about their symptoms.
Right.
Okay, yes, ma'am. I'll look into it some more. We can put that out on our communications. We're also trying to create a resource center for, so people can see everything all in one central location. So we'll include that kind of information along with the COVID-19 hotline that the Department of Public Health has put out. And there's a lot of other resources. So we're trying to organize that. It's a lot of information so that employees know exactly where to go to get information and how to communicate with us as well. So thank you.
And
Okay, Chairman.
the other thing, Mayor, Austin was on at 10 while we were on too. And I don't know what that was about.
And Chairman, we have Mr. Jones' hand is raised. Mr. Emister.
Hello. Can you all hear me?
I'm waiting on the chair.
One moment, Mr. Emister.
Oh, sorry. I'll cede to you,
My
Jay.
doctor's office is calling me and I can't mute it. So I muted myself. If there's no more questions for Erica, we'll move.
No. We had some questions. When you was unmuted, we had said we had two people who had questions. I'll go ahead and move forward. Erica, I appreciate the presentation. It looks very, very good. I just want to make sure that we encourage our operators, because I'm getting a lot of conversation that we're not encouraging them, and I know that's not on you, but and this is for Michael all the way down. Make sure we're encouraging our operators to be safe out there, that we do care, and we are monitoring the situation carefully.
Yes, sir.
Okay. Thank you, Commissioner
Thank
Jones.
you.
We have set up some town halls so we can kind of with the employees, all employees, so they can call and ask questions. We can give information on what we're doing behind the scenes, because Erica and her department, Steve, Wendy, and HR, Terry, and finance, we're still doing a lot of things behind the scenes to make sure that folks get paid, the vehicles get clean and whatnot, and they just don't see that. So we have set that up so we can express our appreciation for what they do and give them information on what we're doing on behind the scenes to make sure they're safe as they continue to help the public get to where they need to go.
And before I move on, how are we communicating? Because I know this is a process. How we communicate with the not the operators, but the patrons who may not be a normal rider, that this is how we're doing things. I understand we're using the operator as a first line, but what are the second and third line defense to make sure that we're keeping that separation from the operator and people coming on those buses?
Well, for those who have social media, we post press release. We have information on the website, and we also, this same information is the call center advocates have that information. So if they call the call center, they're going to say the same thing that the press release says, that the website says. We're trying to be consistent with the information we're giving out to the public. So the best way I can answer that question is either they call in the call center or they check the website. And that's how they'll get the information that we're putting out.
And how are we guaranteeing the, I guess, the social distancing, the 6 feet and all that other good stuff?
I'm glad you brought that up. What we've done is we have, and it's on the website, that we've limited the capacity on the buses to 50%, and asked the passengers to spread out. I don't know if we've gotten, we're working on getting some information or some placards in the seats, which we saw some other properties were using, which basically says one person to a row. That's how we are doing the best we can to protect the public and to protect our employees from full buses. I'm sure you understand that. Well, that causes problems in and itself because you know, there's going to be times where you know, passengers are going to be passed up because of the social distancing, and we're doing it. We're monitoring that, and we're seeing when the complaints come in, which routes they're on, and we're reevaluating if we can possibly, you know, put more service out on those particular routes to make sure that as we social distance, we don't deprive customers the ride to where they need to go. So it's an ongoing process, Commissioner Jones.
And that brought me. I got enough. I got more questions in tied to the ridership that I'll wait to the ridership portion. I'm just really trying to focus really on the safety portion. And so, how much is our supervisors, I guess, actually active out there being supplement to those drivers?
I think Wendy can answer that question, what she's instituted with the supervisors. Wendy, are you on?
Yes, let me unmute Miss Wendy. One moment. Miss Wendy?
Yes.
Okay.
I don't know if you heard Commissioner Jones' question. He wondered, his question was, how are the supervisors interacting with the operators and supporting the operators and the customers out there in the field?
I mean, both the control center and the street supervisor, you know, are on the premises as well as myself. So the supervisors have stationed themselves at the transit center predominantly throughout the day. They may leave for an accident or, you know, have to go to another location. But we're on the street and we're in the control center the entire time the operators are out. And we've, you know, so we're in constant communication with the operators.
Okay.
Thank you, Wendy.
We have visibility of the buses. We, you know, if we have an issue, you know, we've had to call the police a couple of times, but I mean, we're very active with the operators.
Okay, because my concern when we went to fare free, I would figure we would have. I know we're going to lose ridership because we got the COVID thing going on, but I know we're going to increase some ridership out there too, somehow, some way.
Well, I think on the weekend you're seeing more, you know, probably non-working related travel.
Okay.
Because we've seen a drop in ridership, you know, Monday through Friday. And I'll let somebody else talk about that, but we're tracking that.
Yeah, we can talk about the ridership part, Commissioner Jones, when we get to the service delivery, if you like.
Okay. That'd be helpful, man. I appreciate it. Thank you.
Thank you.
Okay.
Any other questions for
Yeah,
Erica?
I've got some real quick. Can you hear me?
Yep.
Yes, sir.
All right, groovy. Yeah, great presentation. Very informative. I really would like to applaud everybody who worked on the posters that are going to go up on the buses. Those look great. They are clear. They gathered my attention, and they provide, you know, just simple information for people. I think, you know, I'm always just so attentive on design because it is extremely important when there's limited time to communicate complicated information. So that looks great. Put them everywhere. I love them. I also like the memes. I'm a big fan of memes. I do have some concerns about ridership and routes, but I'll also save those comments until I think a little bit later. I would like to know, are we putting up information about the changes on the bus stops? Or is that something we can do or want to do?
I don't think we put information on the bus stops. We concentrated on the website and having, like Wendy said, a supervisor at the ITC and getting the information out to the call center. That's where our concentration has been.
Got it.
Mike, excuse me.
Go ahead, Patricia.
We have also posted information at the bus bays here at the I.
So I can't make
Yeah,
it.
Patricia, we can't hear you.
In addition, we've worked on some customer flyers to, to address your question, Mr.
Hey,
I
Patricia.
still-
Patricia,
Yes.
it might be best if you send me an update with with an update of send me an email with the update you're trying to give, and I can include that with an update to the board because we can't make out what you're saying.
Okay. Is this any better?
Not
really.
Not really.
Okay. I'll send an email to Michael.
But great
Okay,
posters.
thank you. I heard that.
So yeah, if, just some more information on different ways, innovative ways we can get this information out to folks. I'm seeing a lot of drivers taking some really cool initiative of, creating their own masks or finding their own masks, which it'd be really awesome if we can get some, but I also know, that's a national thing. So I think it's pretty cool that we've got staff doing that themselves. And yeah, I would also just encourage, an extremely transparent, social media presence on this, because I feel like, we're doing a really interesting response to this. And the more that the more communication, the better. It's never going to hurt.
Yes, sir.
Absolutely.
I'm good.
Anybody else? Okay, thanks again, Erica. Wonderful job. Just keep us updated as you get new information. I know it's changing on an hourly basis in some cases.
Yes, sir. Thank you.
Chairman? I'm sorry.
Okay, let's move on to the executive director's report. Mike.
I think Beverly had
I'm sorry.
Beverly had something, Chairman.
Yes, Beverly.
Okay. I just saw Commissioner Odell's hand raised, but I think he went out. Commissioner Odell, were you trying to say something?
No, I was pushing buttons.
Okay, all right. Thank you.
Okay, Chairman, do you want me to go ahead with the executive director's report?
Yes.
Okay, so this report and this board report is based on February, but I know most people are interested in what's going on now in March. So we'll limit my conversation on February and pretty much just talk about what's going on now, because I know that's where the interest is. I do want to point out that Erica was able to secure hand sanitizer that she found, because you know how hard it is to get supplies. So we reached out. That was one of the recommendations at the last the special call board meeting, to reach out and see if we could, and at governance, if we couldn't buy things from our normal suppliers, to see if we can reach out to some other suppliers. We were able to do that and secure some hand sanitizer. So that's hats off to Erica out there searching and finding things finding enough supplies to keep our people safe. So I just wanted to mention that. As far as manpower, I want to talk a little bit about the manpower. So far, we're holding steady. However, there have been a few cracks in the volunteers, and I will say, as this situation evolves here in our county and in our city, there's a pretty good chance that more of our volunteers may start dropping off the volunteer list. If that's the case, we will continue to put out as much service as we can with the staff that we have. And I just want to make you all aware of that. Although we are solid now, we are using just about every volunteer to get the service out. And as we all know, it's a modified kind of a hybrid Sunday schedule, with a couple of routes added in and a couple of trippers added in as well. The ridership numbers are, and I don't want to rain on anybody's presentation here, but the ridership numbers are down anywhere from about 55 to 70% on the fixed route side. The paratransit is holding pretty steady because you have the dialysis patients, and those folks, although the Sunday rides were down quite a bit, which is to be expected. The rest of the week, the numbers are down, but we are still. I want to stay steady with the on the para side. Let's see, and I'll just kind of morph into the service delivery report. As it pertains to last month, I will just say, we did have a good month as far as our passenger per hour on para. We continue to do very well in preventable accidents, and our on-time performance is nowhere near where we want it to be, and that can be addressed. And we've talked about this through a route redesign, so to keep the flame alive, if you will, with that thought, that would very much help as far as on-time performance. Other than that, I'll be happy to answer any questions related to service delivery or executive director at this time.
Thanks, Mike. Any questions for Mike?
You're welcome.
I've got some.
Mm-hmm.
Am I good to go?
I'm not sure who it was. Is that you, Jay?
That would be me.
That was Clint.
Oh, go ahead then.
Alrighty. All right, I've got like a list of things. Okay, so the first one is as I've been getting a lot of contact from folks that are very concerned about the limited number of buses available out. When I talk with them, and then I say, well, we're kind of managing two challenges. One is to provide as much coverage as we can. The other is that we're losing drivers, and that's that's the fine line between the two pressure, between that and the other. That's how much service we're able to deliver. As soon as I say that, almost everybody that I talk to begins to understand that challenge. So I don't think that we're communicating adequately what our challenges are as a transit provider. And I think if we can be more open with that, with all of our stakeholders, then a lot of people will be able to understand, the challenge that we're facing here. We're not removing transit because we like to remove transit. We're removing transit because we are we're protecting our drivers, and we're running out of drivers. So every time I talk with somebody about that, they begin to understand and realize, okay, sounds good. So I would say,
I'm sorry, Clinton, I didn't mean to cut you off. I just wanted to say that there is information on the website. One of the last bullet point states that, we may need to adjust service levels based on as the situation or staffing levels dictate. Maybe we need to highlight that or put it in a more prominent position. So we'll look at that.
I would also say, if you were to get on Facebook Live and talk about some of these things, people would find that very helpful, I think. Just to sort of break it down real quick, and just be like, hey, here's a human telling you what you need to know. I think that would help a lot.
I agree. I so agree.
Yeah, I think that would be pretty cool.
Yeah, Mike, have Patricia set that up.
Michael, the human element means a whole lot, man.
It does, especially now. And I think, just having as many updates, we cannot over communicate at this time. There's so many people on Facebook right now. It's crazy. So then the other thing too, looking at the routes a little bit closer, it seems that we've got 2 buses on 25 MLK on Sunday, and then that becomes, but there's only 1 bus on that route on Monday through Saturday. And so it just kind of seems a little bit odd that on our slower day, we've got 2 buses there, and on the rest of the week, we don't. So I don't know, where that comes from, but I did just want to talk about that.
And I know I'm going against my norm, but I second that comment right there.
Yeah, thanks, Jake, because that's, I was like, that seems a little odd. And if you, let me know if there's a good reason behind it. I'm totally down, but just looking at it. And then also just the trying to understand the routes, I feel like I'm a fairly competent person, and it did take me quite a while to figure out what buses are running and when, with the way that they're displayed now. Although major props to some of the changes on the website, it is now a lot easier to find that information than it was. So that's been helped a lot. And the last point I've got or question is, you know, I kind of feel like our most important and our most vulnerable riders are going to be those that use paratransit for medical services. And so as I don't know if we can, you know, if we have any ability to prioritize those as we sort of get squeezed out in the next couple of weeks, but we may want to, you know, what is the last service that we will provide? I'd be interested to know.
The FTA requires us to provide everything simultaneously. We can't pick and choose when and what we run, and we can't determine who gets priority on paratransit.
As we, and I guess anybody could answer this, but there, you know, I've heard you guys talk about, well, eventually we may not be able to provide any service. And I just kind of wonder, what does that look like on that week or that day? And if you can help us,
Chairman.
you know, with that, that might be helpful.
And Chairman, we have Ms. Terry's hand is raised.
I'm sorry, I'm not hearing you, Beverly.
Ms. Terry, were you trying to say something? Ms. Terry's hand is raised.
I was trying to respond to Clinton.
Hi, Terry.
Hey there.
Guys,
so,
I don't have the hands up sign, so I don't know who's up. I have to depend on Beverly to see it.
Got it.
So if we were to suspend service except for critical medical care for paratransit, and I guess examples of that we're all familiar with would be the dialysis or critical medical treatment. The FTA provides something called an emergency relief docket. So I have been reviewing the rules, reviewing the procedures, and if we were to suspend all but the critical medical, then we would apply for emergency relief from the current complementary rules. So there are procedures in place, and as soon or if and when the situation escalates, we're trying to stay in front of it with what we're supposed to do and plan these responses. But as people have said earlier, this is ever changing by the hour.
Yeah.
So there would be some relief through the ER relief docket, and I would expect under the current situation nationally for the FTA to expedite permission or approval, or yes, pending formal approval later. So there are some outlets, and we will implement procedures to take advantage of those when the situation dictates.
I also think if there is even if there's a non-zero chance that we may be ending service, then we need to tell people that we may have to do that, so that folks can start thinking about what their alternatives might be. And you know, I think you know, like if there's a 1% chance that we might be ending service in the next month, I think it's our duty to let people know that that might happen, so they, you know, they have a week or more to prepare and try to, you know, figure out what they're going to do.
The data that we're compiling right now that gives me service hours and cost for the past 4 days will allow me to calculate these cash on hand and give you a feel for those estimates. So we're a couple of days from being able to look at it in a timeline and back it up to the most notice possible. And there's a lot of moving pieces, there's a lot of ifs and thens, but until I get service levels and associated costs, it would just be a global estimate. So if you can give staff 72 hours to get that information together, then we can set up a reasonable timeline with that in mind. And of course, it just depends on duration. We're watching it every day with the numbers we have, and this first 5-day period and the cost associated with it will give me a foundation to give you a more accurate estimate. So by the end of the week, we should be able to develop that type of timeline and just know that we've got to give everybody, passengers, employees, as much notice if it escalates into that situation.
Chairman,
Got
Ms. Erica was trying to say something as well.
Thank you,
But I
Terry.
think Ms. Terry answered it. Ms. Erica, did
Yes,
you
ma'am.
want to add to
Terry
that?
said it. Terry covered
Okay.
it.
Okay.
Thanks.
You're
Thanks,
welcome.
Erica.
Any other
Beverly,
questions?
is my hand up or down?
I'm scrolling down. Let me see. Your hand is
I'm just
down.
trying to do it. Okay, I'm just trying to do it right so as not to confuse you. Thank you.
Okay. And you're not muted, so if I don't
I'm
get to
going to
you,
mute
you're welcome to
myself
speak.
now until y'all need me.
Thank you.
Okay, we have any other questions? And yes, we are good. We will be giving as much notice as we can. There could be a day where we have no drivers left.
Yeah.
We can't tell them they have to give us 2 weeks notice. If they decide that they cannot do the function, then we have to notify as quickly and as we can. And I'm sure we have that in place when and if we have to go there. Plus we have
We do.
to watch our money.
Yep. And
We don't have an unlimited budget.
right. And things are evolving every day, and so it's a fluid situation. So there may be the notice we give may be shorter than you may like as a board, and we may like as a transit agency. However, we may not have the luxury of giving an adequate notice. It may be something that may be 2-3 days. It's hard to say at this time, but we'll do our absolute best.
And
we appreciate that.
That's, I think, the importance of telling people to, put together a backup plan now. Hopefully we don't need to use it and they don't need to use it, but if you just come up with one now so that if we do and we don't have lots of time to get that news out, they can just, switch over.
Okay, any other questions? Okay, let's move to system development. Patricia?
Is Jay there? Did he have it? I just want to make sure that he's not.
I'm here, Bubba. I appreciate
All
it.
right, cool.
My hand keeps going up and I'm not hitting that button. I don't know why. Okay.
It is. I keep putting it down.
Hey.
It's up again.
Can you all hear me?
It sounds real extra.
Hi, Beverly has me unmuted. Can you hear me any better?
Yeah, it's
not really.
very.
It's going in and out, Miss Patricia.
Going in and out, yeah. Anyway, I just wanted to share with you all that my report is in the board packet. As Tom said, I know you're really interested in what we are doing to get the word out regarding the community health crisis that we're in right now. We have been putting out numerous news releases and media advisories, and I'm sharing those with you all. In addition, when we went to the reduced service level, we posted flyers at ITC space, and we also posted those up window. Posted modified.
Miss Patricia?
Hey, Patricia.
Yeah.
I'm
Patricia?
not hearing anything.
Yeah, we can't hear you. So let me tell the board a couple of things I know that you've been doing. So they've been actively putting out news releases. They've been actively updating the website. They also posted information at the ITC for customers, so they know about the service levels and whatnot, social distancing. And her department have been actively getting information out to the customers, being transparent, and trying to be proactive in making sure that the information is getting out to folks before we implement a service change or something happens. So that's pretty much it in a nutshell. Her and her department has been busy behind the scenes, just trying to make sure we get the information out as needed.
All right, thanks, Mike. Yeah, I know like I said, it's changing every day, and I get all the reports and I'm reading them, and I think we're doing the best we can.
Yes, they were able to post flyers at the ITC and at the windows and in the bus bay. So that's been very helpful.
And there are call-in numbers for the state, the county, for information on COVID. We're posting everything we can. If you have suggestions or you think something that absolutely needs to be done that isn't being done, you can email it to Mike. He can make those decisions. Any other questions, or can we move to financial?
We were also mentioned on Mayor's News Conference this morning about social distancing. Mike, did you see that email?
Yeah,
I saw
can't tell what you're saying.
Yeah, we were constant mentioned us this morning.
All right, anything else? Let's go to Terry and the financials.
The financial update and the financial report month to date and year to date through February is in your package. I can answer any questions about those numbers, but wanted to zero in on the financial impact of our emergency response and also the current available options for reimbursement. The CARES Act, I've been reading those 800 pages. It appears to be very generous in the government's ability to help us recover these costs. The numbers I'm reading say 280% of our normal annual apportionment funds, which for us is, on first calculation, about $10 million for the duration. While the money's there will be a time delay as the FDA completes the notice of funding and agencies have to go through the procedures to access the money. And what the requirements look like and how long that will take is yet to be determined. From a financial perspective, the service levels and the payroll associated with it that I referred to earlier will help us project and estimate, but without those numbers, I do feel like we can afford reduced service with caution for only emergency functions. Reduced service is not reduced cost. It's actually a premium on top of normal cost because of our efforts to keep our employees whole. So it's looking like a 6-week window until we receive some money due from the city, and that goes up to an 8 to 10 week window of cash available. As the developments occur with the options for reimbursement, we can continue to update the board, but it does look like there are mechanisms in place to eventually recover most of these costs. And with that, I'll answer any questions the board may have.
Okay, I guess, Beverly, you're going to have to let me know who's got hands up, so we'll take questions.
Yes, sir. No hands are raised at this time. And everyone is unmuted.
Okay.
I mean, just to make.
Sir. Okay, Mr.
Yeah,
Anster.
that was my So I just want to kind of make sure I've got that understood. So according to the formula, and a base calculation that you've done, an initial calculation, we have access to up to $10 million for the duration of this. Is that
right? But
yes.
it won't be a gift. The same eligible cost requirements that we operate under for 5307 will apply. So the definition of FTA's operating cost kind of determines the possibility of recovery. It's all very general right now, Mr. Edminster. So as we get more information from the FTA, it'll be clear what and how. But of note, in this particular offering, is that they are including things they haven't included before, like possible reimbursement of revenue loss. So it's a generous package, and as we work through it, it's going to allow us to recover and go back to normal operations. The details just are not fleshed out yet. We still have rules. We still have to apply. There's still going to be a time delay. My guess is that there will be some kind of expedition of the process, and there will be a way to get it at least monthly, right? They're not going to give us $10 million, but maybe in every 30-day window, we'll be able to say the last month cost us this, and they'll reimburse us that amount of money. It just won't kick in until all of the behind-the-scenes application and paperwork and mechanisms are completed.
And
I'm hoping that we'll be able to access some of this money within 60 days because of the nature of this emergency.
Yeah, that's my guess. And this is part of the
That's just
25 billion
again,
set
it's just-
aside.
Yes, it appears that they're going to give us 280% of what we normally get. So for 5307, we normally get about 3.6 million. So when you do the math, it's a little over 10. If there's an extra supplement for our 5339 bus facility, that might be another million. But it looks like somewhere around 10 million will be available. It's just how to access it and the timing that's unknown right now.
Okay.
Very generous, very generous.
Yeah, for sure.
And of course, we will not get what we don't need. I don't anticipate them just giving it all to us. I might be surprised. That's the details pending clarification as the days go on.
Thanks, Terry.
Thank you, Terry.
And of course, our immediate concern is going to be the end of those 8 to 10 weeks.
Correct. And
because at that point, we've wiped out our line of credit and our money reserve of cash.
Right. And there's some alternatives midpoint in that scenario where we can reach out for additional coverage. But right now, we're good, and I really need the absolute data to do any kind of meaningful projection.
Okay.
So end of the week on those numbers.
We'll wait to hear from you on that.
Okay.
All right. Any other questions? I don't think, do we have any old business? I don't see any listed that I remember.
Ms. Dion, do we have anything from Ms. Stone?
No, ma'am. The call was disconnected
Okay,
and I've been unable to reach her.
thank you.
You're welcome.
No old business then?
There's another, let's see. All right.
Hello?
Hi, I can hear you.
Hello?
Yes,
Hello.
sir.
Mike, we had old business, right?
I don't remember if there is any old business. None's listed.
All right. I want to old business. I want to update on where we at with that safety issue we voted on last month with the sidewalk.
Oh yeah, Mike or Steve,
Hey,
I
Steve,
guess.
Steve, can you give us an update? I know there's with all this coronavirus thing going on, that kind of set us back a little bit. Steve, can you give us an update?
He's coming on.
Okay.
And we're setting up the account with ABC Caraway, And soon as we get through this, we'll get them in here and get the concrete poured.
All right.
Right now, with all the buses sitting in the yard, there's no way to move them out where we can get that concrete busted up and poured.
Okay. It was notated a safety issue. Remember, me and you walked through the actual parking lot. What safety measures have been put up to make sure that operators are not walking across that parking lot to create any other safety issues? Especially with more buses in that parking lot.
So at this time,
Can you hear me?
Yep.
I know we put signs on the doors to tell them to watch where they're walking out there and all. And as soon as we can get some more stuff like me and you talked about, Jay, we're going to paint the yellow lines out there and create a different crosswalk.
Okay.
But right now, with everything that's been going on with us getting all these cleaning supplies and all, we hadn't had time to do that because I got all the amenities people out there spraying the shelters and all. So soon as we get a chance, we're going to create a sidewalk, paint yellow lines out there where they got somewhere else to walk instead of walking straight across.
Okay, so are we making sure the operators understand we need to walk a path, or do we have cones up or anything? Because currently, right, and I'm not knocking for what you're doing. I understand we're doing all this other stuff with COVID-19. However, we're still in the same safety issue we're in if we didn't put some kind of impediment to keep people from crossing over the sidewalk, whether it be cones saying do not cross over the sidewalk or whatever it is may be. We're still in the same safety problem that we had pre-existing before we voted on that thing last month.
Yeah, I think what we can do, Jay, is between Erica and Steve and I, we can see if we can come up with something that'll work that's feasible right now. All of our attention has been gone to making sure we, battle this COVID-19 and coronavirus. So not that is not important, because obviously it is a safety issue. But between the three of us, we can kind of regroup and see what measures we can put in place right now to mitigate the risk.
Yeah, because the only reason why I'm stressing it was treated as a safety precaution issue, and we didn't want any more liability. And it was kind of pushed toward me to make sure we voted on it because it was emergency procurement. So I want to make sure I understand that COVID-19 is a safety issue, but that is a safety issue too if we said it was an emergency issue, like we stated at our last meeting.
Yes, sir. So noted.
Appreciate it.
Any other questions?
I'm good.
Okay, and just for those on the ad hoc committee, a reminder that we have a meeting at 12:30 with KL2.
I'll see you guys there.
And I'm not sure, is everybody comfortable with having committee meetings next week with this kind of format?
Yeah, I'm cool with it. I don't have no issue. You can ask Helen, Dietrich, and Pete. Hopefully Pete will be in better state. I'm good with it. Okay,
if you have any problems, any of the committee chairmen, if you think it's going to be a problem.
My one point, my own problem, I want to make sure that I abide by what Clinton said. He said he wanted to see me there. We need to come up with some kind of face recognition so we can see each other. I'm just joking, Clinton, because he always said, I'll see you at the next meeting.
We might be able to do that through here, or
you can.
I mean,
yes,
honestly, if we, I've got our stakeholders meeting, committee meeting. I don't know. I'm fine with meeting, but also
let you chairmen decide how you want to run your meetings. And if you decide you can't do it for any reason, just make sure you give us proper notice.
Will do.
Hey, Dr. O'Halloran, I just want to, from a staff point of view, it's going to be a little difficult for us to prepare for committee meetings and while we're providing our emergency response. So that's why I've asked if we could maybe, until we kind of get through this a little bit, suspend the committee meetings.
I would be in
It puts
favor
a
of
lot
that.
on staff. It just puts
I
a
would
lot
be-
on staff to prepare.
I'd support that. Maybe if we just want to do like the governance committee, just so we can kind of touch base, between
Well, we're going to need
this
to
and the
do
next
that
board
one, yeah.
meeting.
I mean, if there's stuff that you're working on that doesn't need any additional staff input at this point, then I guess that could be done. Got to remember everybody's working remotely,
Yeah.
and communicating this way is difficult to come up with a lot of conversational back and forth, but
This is
Agreed.
Dr. Robinson. My committee does not need staff input at this time. So
okay.
I'll be in touch.
All right, just let all your members know that you're going to, because we have to announce whether they're going to be held or not, and that has to be public.
Will do.
So if you know by Friday you can have your meetings without any difficulties, then we'll go ahead and do them.
Will do.
But if we, don't expect staff updates on stuff that's pending, because we have other higher priorities at this point.
And
All
Mr.
right.
Emissaire? Did
Thank
you
Any
you,
want
other
Dr. Earl.
questions?
It's
And
likely that the
Sarah.
stakeholder committee won't meet unless we need to, but my guess is that I'm not going to do that. But I will
Okay.
be there for everybody else if anybody needs me.
All right, just let Beverly know so she can post what meetings are being held and not being held.
Absolutely.
I assume the CAT public meeting for the month of April will be canceled.
Yeah, I saw your email. We've been doing so many other things. I haven't really circled back to that, Dr. O, but that's likely. If we can't do it remotely, we probably will cancel.
Yes, and I saw that ACAT is canceling and MPO canceled, recommending we
It's
cancel
probably
the ADA focus group as well.
okay.
Because if the ACAT people are not coming, and they have very little chance of isolating in that room at the center, that we cancel our focus group, because I'm assuming Scody is going to cancel as well. So that's
Mr.
the
Chairman?
Monday and Wednesday meetings.
Mr. Chairman, Ms. Terry hand was raised. Terry, were you trying to say something?
I was just reminding everybody that with the current emergency response, anything we ask staff to do creates extra cost and limits the amount of time we're going to be able to provide service and extend sustaining operations. And I think Mike handled it. I just wanted to make sure we all realize that normal course of operations business is costing us more in this situation and shortens the amount of time we're going to be able to serve our public and take care of our employees. From a pure financial standpoint, I think we need to keep that in our minds.
Mm-hmm.
Thank you, Terry.
Anything else, folks? All right, hearing no other comments or old business, I'm adjourning the meeting at 12:09.
Thank you, Chairman.
Thank you, everyone.
Thank
Have a good
you.
day and be safe.
Goodbye. Same to you.
Bye. Thank you.